Due to a lack of supplies because of last century's solutions of delivery via trucks, trains, and washed out roads, healthcare access is not as available to populations in countries like Rwanda and Ghana. This results in consequences of more deaths and diseases left untreated. With technology rapidly improving, companies like Zipline finds new solutions to combat issues like access to healthcare. Zipline is a drone delivery service that serves as a form of beneficial disruptive technology for the healthcare industry. Created in 2014, Zipline's mission is to provide every human on Earth with instant access to vital medical supplies. The mission statement is ambitious and difficult to achieve, but demonstrates the Jesuit value of magis, the challenge of striving for excellence. Zipline recognizes the obstacles and challenges of implementing their drone service worldwide, but with the right mindset, the company was already able to help two countries, Rwanda and Ghana, and is already planning to expand even wider outside those locations. The high success rates and excellence of Zipline are due to the intricate processes of designs and technology being tested in Half Moon Bay, California, followed by the technology and the drones being assembled in San Francisco, and approved through by extensive flight testing in Davis, California. Over 2 million people do not have access to healthcare because of the lack of infrastructure to be able to operate a medical facility efficiently and effectively. For example, in Rwanda, there is over 14,000 kilometers of unpaved roads that make it difficult for transportation to cross. This could take up to hours and potentially a lot longer than expected if the weather forecast is bad due to washed out roads. By the time medical supplies are delivered, it could be too late for a patient. This is the situation that Zipline's mission statement is trying to solve. Zipline practices the Jesuit value of cura personalis because it concerns and cares for the people. Mostly, Zipline cares for the dignity of the body, but with its company culture, it provides a positive experience for patients and hospital staffs to have a hopeful spirit and collaborative mind. With Zipline's advanced drone delivery technology, hospitals are able to partner with Zipline to achieve a cold supply chain. Since blood has a short shelf life and if it is not stored at a proper temperature, it easily goes to waste. Delivering blood bags in bulk to hospitals is also not the most effective either, because there could be extra blood bags sitting around that are never used, when some patient in a different location could use to save his or her own life. Zipline helps solve this problem of medical waste by delivering on-demand medical supplies. With Zipline, there have been 0 units of expired blood at hospitals that uses this service. The extra benefits of a cold supply chain is that it can be used in disaster relief scenarios and allows supplies to be centralized. Blood bags are one of the most important goods that Zipline delivers. This is due to maternal mortality rates that areas like Rwanda and Ghana face. Oftentimes, mothers will give birth to their children but will start to excessively bleed due to complications. If there aren't enough blood bags in stock of their blood type, there could be a consequence of death. Children would have to grow up without their mothers. This is Alice, a mother in Rwanda. Alice said, "I used to see the drones fly and think they must be mad, until the same drone saved my life." Zipline has provided 11 million people with instant access to urgent medicines and have saved 11,721 lives, including Alice's. Both those numbers are continuing to grow, and this is how they have been able to help. When a patient is in a medical facility and is in need of a medical supply like blood, a vaccine, etc., in this scenario, let's say that the patient needs a blood bag, and the supply is not available at the facility, a doctor or nurse will send a WhatsApp message to the Zipline team. In approximately 5 minutes, Zipline will receive this message and start to move quickly. An employer from Zipline will pull stock from the National Center for Blood Transfusion and scan the blood bag into the system for inventory. The blood supply will be packed into the Zipline drone, an autonomous battery-run airplane. The drone races from 0 to 100 kilometers per hour in half a second from launch to sky. To avoid in-air traffic, Zipline has its own air traffic controller that calls into nearby international airports to collaborate with the other aircrafts so the drone can safely fly to its designated area. Just like ride-sharing, the doctor or nurse will be notified 1 minute before the package will be delivered. The doctor or nurse will walk outside and receive the delivery where the package will be delivered from the sky via parachute. There is no interaction with the drone needed, as the drone will automatically head straight back to Zipline's facilities. Throughout this process, data packets and a GPS connection allow both consumers and Zipline to know exactly where the drone is and how its flying condition is, meaning that if there is something wrong with the drone's flight and is unable to deliver the medical supplies, the Zipline team would already know and would already prepare a new package and drone to be sent out as soon as possible. Even though the drone flies over mountains, rivers, and more, this process can take approximately only 20 to 30 minutes from order to fulfillment, which is a quick delivery time necessary in a time of need. One of Zipline's values that helps them deliver is continuous improvement. Working with a global diverse team of creative minds, doctors, nurses, engineers, and more, Zipline uses design thinking to continuously evolve into their goal of being the automated delivering system operating on a national scale in the future. As said on its own website, no idea or decision is permanent. We want your experience and intuition to make Zipline better in every way. Zipline makes 500 deliveries per day, rain or shine, and with continuous improvement as a community, this life-saving delivery service can become more accessible, cost-effective, and efficient to the healthcare industry.